Okay, I think we'll get started. Thank you everyone for joining us today for the launch of the Human Rights-Based Approaches to Comprehensive Abortion Care online course, which is hosted on the World Health Organization Academy page, the organization's Lifelong Learning Center. This course is part of a broader compilation informed by the WHO Abortion Care Guideline released in 2022, which emphasizes the importance of comprehensive abortion care as an essential component of primary health care. We encourage you to explore the full set of courses available on the platform. Before we get started today, I'd like to take care of some housekeeping issues. We do have translation available in French and in English today. You should see an interpretation icon in the bottom of your navigation bar, and you can click on this icon to open the interpretation menu and select the desired language channel to hear the translated audio, and then choose to mute the original audio. Please note that the webinar is being recorded. We will dedicate time at the end of the presentation for questions and answers. But to help us manage the large number of participants, we kindly ask you to submit your questions using the Q&A function, which is also in your navigation bar. And we will review and respond to as many questions as possible during the Q&A session at the end of the webinar. So at this point, we would like to dive right in. Next slide, please. Very quickly, I would just like to note that we will take you through the course, speaking to the regional relevance, as well as how the course was created, both from inception through development, and walk you through how to actually access the course, both from a logistics standpoint as well as from a content standpoint. And as mentioned, this will be followed by a Q&A. Next slide, please. At this point, I would like to introduce Richard DeLate, Program Manager of the Together for SRHR program at UNFPA. Richard? You're muted, Richard.
Good afternoon. One would think after many years of COVID, we'd know how to unmute our mics. So good afternoon, everybody, and thank you very much, Antonella, and an absolute pleasure to be here today for the launch of this course. For the translators, if I speak too fast, please feel free just to raise your hand and I will try and slow down as much as possible. I'll try and take my cue from the pace that Antonella set. So first of all, just to welcome you all and acknowledge all the participants from all the UN agencies and civil society that are present on this call today. Just to say that this course is a joint effort between different United Nations agencies that have come together to combine their collective expertise around to improve the health and well-being of all people, drawing on different perspectives of the agencies involved. Just to go back a little bit in time, the 1994 ICPD Program of Action recognized that reproductive health and reproductive rights are essential components of human rights. The ICPD recognized that all couples and individuals have the right to decide freely and responsibly on the number, spacing, and timing of their children, and to have the information and means to do so, and the right to attain the highest standard of sexual and reproductive health. It also includes their right to make decisions concerning reproduction free of discrimination, coercion, and violence, as expressed in numerous human rights frameworks. The ICPD foregrounded abortion, including the prevention and management of the consequences of abortion to the full extent of the laws of countries, and post-abortion care everywhere as a core component of reproductive health and reproductive rights. The WHO guidelines is a welcome addition to ensuring that women and girls can access quality abortion and post-abortion clinical services, free of stigma and discrimination and underpinned by human rights. The course that we are launching today is grounded in global human rights instruments and a global promise to ensure that every individual can live a healthy and productive life grounded in rights and choices. For many young people, access to contraceptives remain out of reach. Many women continue to have limited access to contraception to decide when and how many children they wish to have. Many other women experience the pain of unintended pregnancies linked to rape and sexual violence, and several in desperation will turn to unsafe abortion as a means to terminate an unintended pregnancy. This is also owing to family and societal stigma often linked to adolescent and unintended pregnancies, and the shame that women may face as a result of the violations of their bodily integrity and also their ability to decide their own fertility. For many women, particularly in developing countries, this will result in death. Therefore, if we talk about human rights, we need to ensure that we uphold the rights that women and girls everywhere are able to exercise their rights and choices to safeguard their health and well-being so that they can fully and meaningfully contribute towards the development of their families, their communities, and nations, while ensuring that they receive quality integrated services rooted in human rights. These fundamental rights include, but are not limited to, for example, the right to health, which requires that all people are protected from the risks associated with unsafe abortion, are provided with accurate health information, and are ensured access to quality integrated abortion and post-abortion care services to the full extent of the law. This also includes integration with other services or the provision of integrated SRHR services. For example, women accessing abortion care services should be given counseling and information on contraceptives. They should receive also information and counseling on the prevention and treatment of HIV and other STIs. The right to information and education recognizes that all individuals have the right to access accurate evidence-based information on SRHR without fear of criminal sanctions, and this includes the right to access accurate and evidence-based information on comprehensive abortion care. While the right to non-discrimination and equality reminds us that women should have access to contraceptives and quality abortion and post-abortion care services regardless of their age, whether they're living in a rural or urban area, whether they're able-bodied or not. And the right to privacy, where all SRHR services are provided with full respect to the privacy and confidentiality of persons accessing these services without mandating disclosure to law enforcement or a third party. Guided by the WHO abortion guidelines of 2022 and the ICPD program of action, and with the aim to achieve the targets that member states have committed to as part of the Sustainable Development Goals, we continue to work with and at the request of governments to prevent unsafe abortions, to strengthen healthcare systems to provide quality abortion care, and to manage the complications of unsafe abortion and ensure access to family planning and contraceptives. This course is a timely reminder that while clinical guidelines are in place to ensure that policies, strategies, guidelines, and services are developed and delivered with the full respect of human rights of women. This will ensure that we are able to create a supportive environment where women's right is honored, leading to better health outcomes, true gender equality, and enabling women to safeguard their health and well-being and achieve their full potential. In closing, this course is a vital tool for change. Whether you're a policymaker, whether you're a decision maker, whether you're a healthcare provider, this course will allow you to understand the pivotal role that human rights needs to play in the provision of SRHR services, including services for comprehensive and post-abortion care. By undertaking this course, you will not only acquire invaluable knowledge, but you will also emerge as a dedicated champion for a truly just and equitable health system. I look forward to you undertaking the course and also to the way in which the course will contribute towards improving the health and well-being of all women so that they can receive services that are dignified and respectful. Thank you very much, and back to you, Antonella.
Thank you so much, Richard, for that overview. And now we will turn to Leopold Ouedraogo to talk to us about the regional relevance of the course, and in particular, the role of human rights in sexual and reproductive health and rights as it relates to comprehensive abortion care. Leopold?
Okay, thank you, Antonella. I hope you can hear me.
We can.
But maybe let me put this makes more easier.
We can hear you fine.
So thank you, Antonella, and pleasure to welcome, of course, all the attendees of this event, the launching of this important right-based comprehensive abortion care, which is very important for our region, Africa. And we all know that in Africa, many access to comprehensive abortion care remains a significant challenge, obviously known, and due to some restrictive laws, some stigma, and also some gaps in the provider training. We have many gaps, and this is very important for us to see how to improve the training of healthcare providers and also a standardized approach. This is very important for the quality of care. And the human right-based comprehensive abortion care is therefore highly relevant because it addresses these gaps by providing a structured, competency-based curriculum. This is very important, and it empowers healthcare workers with the required knowledge and skills to deliver safe, ethical, and right-based abortion care, which is especially important in regions where women's health and autonomy are often compromised. So this is very important for us to consider. And by focusing on human rights, we cause ensures that care is not only clinically sound, but also respectful and non-discriminatory, supporting the broader goals of health equity and social justice. So just to again emphasize the importance of this cause for our region in Africa, and we hope that will contribute to increase access to health, to quality abortion care services within the region. And talking about the role of human rights, specifically in sexual and reproductive health and in comprehensive abortion care, we can already agree that sexual reproductive health and rights are grounded in international human rights treaties, including, of course, the International Convention on Economic, Social, and Cultural Rights, and CEDAW. These are those international treaties, human rights treaties, that show us the importance of sexual reproductive health and rights. It's very important to consider. And these rights, as we know, obligate states to ensure that sexual and reproductive health and rights services, including, of course, abortion care, are available, are accessible, acceptable, but also of good quality for everyone without discrimination. So all these services should be made available to all those in need. And a human rights-based approach helps reduce unsafe abortion, of course, as we know, and maternal death related to abortion, unsafe abortion, which is still prevalent in our region. So ultimately, integrating human rights into SRHR will help to reduce the stigma of unsafe abortion, but also achieve gender equality and uphold the dignity of all individuals. Lastly, maybe we can talk about why a human rights-based approach matters. Three key points. First, we respect dignity and autonomy. This is very important. Secondly, the regional leadership. And third, the call to action. Regarding the respect, dignity, and autonomy, embedding human rights in comprehensive abortion care, that means that services are delivered with respect for women's dignity, autonomy, and confidentiality, which is very important. And Africa's adoption of right-based comprehensive abortion care education shows regional leadership and commitment to advancing sexual and reproductive health and rights, even in challenging contexts. And to make real progress, this is now the call to action. We need really to integrate these approaches into national policies, health systems, and training curricula. This is the way to go, and we believe that this online course will really help us to reach this objective and make sure that all women and girls in need have access without discrimination to comprehensive abortion care. Thank you, and back to you, Antonella.
Great. Thank you so much, Leopold. So now I'd like to turn it over to Kesa Baka Dikole to talk to us about how the course began and really walk us through many of these elements. Kesa, over to you.
So you're not rich.
Thank you, Antonella. You can see me, it says Richard delayed. We are sharing the space. Just to confirm to the colleagues online, I'm Gesa, and I am going to walk you through the collaborative efforts that we pursued to develop this course and the actual process of developing the course. Next slide, please. So we leveraged our existing collaboration under the Together for SRHR program, where we work closely with WHO to strengthen programming in this area of work. But in addition, we collaborated with another joint program, the Special Program of Research Development and Research Training in Human Reproduction, or HRP, which is housed at WHO. And together, this has created a powerful synergy that measures on-the-ground programmatic experience with the global health standards. And so this course has been guaranteed to be a good quality product from the beginning. And there has been an oversight provided by a diverse group of technical experts across those three entities at both regional level and global level. And by hosting the course on the WHO Academy, which is an online work learning platform, and making it free, this will ensure that the course reaches a wide and diverse audience of healthcare providers, policymakers, as well as advocates. Next slide, please. This has been a rigorous development process to bring this course to you today. And this was to ensure that the course is engaging, that it's acceptable, accessible, that it's accurate, and that it is aligned with modern virtual learning best practices. This therefore guarantees that the course being launched today offers a high quality learning experience, as you will see when the live demonstration is done. And how did we achieve this? The three elements that we combined: first, ensuring that the course development is by an experienced learning content developer who is familiar with modern e-learning principles. And as mentioned, the course is based off of the modules. The modules of the course is based off the 2022 WHO guidelines. So it was really translating this into learning points. And secondly, that we convened a multidisciplinary team that reviewed through and through the course. And thirdly, that we engaged a professional e-learning developer who then designed the course and turned it into a virtual learning product. And as you can see on the screen, this has been an iterative process across these three areas. This multidisciplinary team that developed the course content had diverse expertise, and this ensured that there's accuracy, that the course is relevant, and also that it's aligned to the guidelines. And the Learning Academy consultants streamlined the process, ensuring that they draw on past experiences as someone who works with the WHO Academy, and really leveraging those past experiences to develop this high quality product. In terms of the professional design, an accredited academy developer has been engaged, and this ensured that the course is not only accessible, but that it's aligned with modern e-learning best practices. And we will get to see this once we engage with the course. And this is where I stop, Antonella, and turn it over back to you. Thanks.
Thank you very much, Kesa. So now I actually will walk you through the development process of the course from the respect of speaking about the human rights integration. It's important to note that the abortion care guideline itself has integrated human rights throughout All of the recommendations really focused on various aspects of human rights, including the right to health, the right to life, equity, but also other aspects related to gender equality and gender equity. So next slide, please. The course aims to empower the learners with knowledge and attitude necessary to ensure that a human rights-based approach and its principles inform all aspects of abortion care, regulation, and delivery. And so the course was developed using the guideline as its core reference, but it draws from several treaties, frameworks, and standards, including, for example, the Convention on the Elimination of All Forms of Discrimination Against Women, the International Conference on Population and Development Program of Action, as mentioned by Richard, and the Universal Declaration of Human Rights, among others. And it really emphasizes respect for human rights across the continuum of care, speaking about pre-abortion care, abortion care, and post-abortion care. Next slide, please. It introduces core aspects such as dignity, equality, autonomy, non-discrimination, as well as importance of upholding privacy, confidentiality, and informed voluntary decision-making. But it also speaks to a state or government's responsibility to ensure that services are available, accessible, acceptable, and of high quality. And so with respect to quality, the course, like the guideline, emphasizes the need for an enabling environment. And that environment is built on 3 cornerstones: a well-functioning, universally accessible, and affordable health system, accessible and accurate information for individuals and providers, and a supportive legal and policy framework that upholds human rights. Next slide, please. Moreover, the course demonstrates the link between health and human rights, recognizing that every human being has the right to the highest attainable standard of health. Here I've noted WHO's definition of health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity, and this includes sexual and reproductive health. Because sexual and reproductive health and rights are grounded in a range of human rights, including this right to health, the course supports WHO's efforts to help countries integrate human rights standards into their laws, health programs, and policies by collaborating with other UN entities, such as UNFPA, and we work to build capacity for a rights-based approach among policymakers, program managers, and providers. And so on that note, I'd like to turn it over to Dr. Fareed Abubakar, next slide please, to take us through the actual course, again, both in terms of logistics as well as content. Over to you, Fareed.
Thank you very much, Antonella. So on the next few slides, we will be discussing on how to access the course and how to go through the course content. So let me put this back in. Yeah, so I will just leave it here for a few minutes, so people may, if they want to tag along with the registration in the accessing the course part, you can just scan this QR code and it will take you right to the web page of the WHO Academy, where the actual human rights based approach is hosted. So without further ado, so when people first log into the web page, this is a landing page that you will access. And if you are joining for the first time, you will have to register. And at the registration, you basically, it is just a basic step as any time that you create an account on any website, where you will have to provide a name and an email address and create an account with a secure password, which will give you access to the whole sorts of WHO Academy courses, including this one. But if you're joining, let's say you have started this course and you're joining back, you can just click on enroll and you will be able to come to that page. So this is how you register on the page. Click on register. Then if you are coming back to the page again, you will use the login option, where you will be able to resume where you stopped from the previous session. So once you have created your account, sometimes, for security reasons, you may get a two-factor authentication, and you may receive a link to the email that you have registered. So make sure that you always have access to that email that you initially registered with. So as soon as you log into the course, this will be the landing page that you will see. So on this landing page, you will have two sections, overview and the module section. So with the overview, it just gives you an idea of who is this course is intended for, and what are the modules that you will go through. So basically, this course is designed to have 3 modules and one more module, which is kind of a summary module and more of an interactive Q&A questions to consolidate what was learned throughout the previous 3 modules. So again, if you don't have to finish the whole 3 modules in one go, there is an option. We understand people that may not be able to do the whole course. Basically, it's about 3 hours, but it's understandable that someone may do half an hour at a time and come back to finish. So you just come back and click on the enroll page, and it will take you right away where you stopped from the previous session. So on the first learning section, this is what you will click on the learning, and it will take you, and you will use the navigation bar at the top right, where it takes you to the next or previous section. So once you have done, let's say, 2 lessons, and you want to come back, then you will click on the resume lesson part, and on my learning tab, you will be able to get where all courses that you have done, or something that is still in progress. And you can see now on this one, it is 22% completed, but there are still some remaining items, so that the learner have to finish before getting the actual certificate of completion from the WHO Academy. So as I said, if you come to this navigation bar on the left side, you will be able to see the My Learning and Achievement section. And the Achievement section is where all the courses that you have finalized, and the certificate of or award of completion will be available. And if you want to look at what courses that you are still enrolled on, you will click on Enroll, and you will be able to continue from where you stopped, as we discussed earlier. So what is the way forward? Currently, yes, this is one of the courses that is already finalized and available online. We also have another course on medical abortion that is already available on the WHO Academy site. So if you go to the search bar and click search for medical abortion, you will also be able to access that course. So currently, both the human rights integration and the medical abortion course are online. Going forward, we are in the final stage of finalizing 2 more courses on surgical abortion care and post-abortion care, so that by the end of the day, we will have a whole comprehensive abortion care program that will be able to empower healthcare providers and program managers and policymakers on the whole spectrum of providing quality abortion care. So this is what I have. Back to you, Antonella.
Great, thank you so much. So I will now like to open up for our question and answer session. Hopefully you've found the information that we've shared so far informative. Some individuals have already started using the Q&A function, and so we're happy to answer questions as they come in. I'm actually going to ask Hessa to come on now to help us moderate this Q&A session and see if there are any potential additional questions that need to be answered.
Thank you, Antonella. I have the pleasure to moderate the Q&A. We have received a couple of questions in the Q&A already. And as mentioned at the beginning of the webinar, we will answer as we go. We now open it formally for a question and answer session. And we invite you to type your questions in the Q&A. And as you are thinking of the questions and formulating them and typing them, perhaps I could get us started, dear panelists, with a few questions that perhaps would help to buttress some of the messages. And I'd like to start with you, Dr. Ferid, if you would like to reiterate the primary target audience for the course and how this content and learning activities are tailored to meet their specific needs and in their professional context. So again, quick question, who is the primary target audience? How does the content and learning activities, how is it tailored to their specific needs and professional context? In there, you could also include, since the course is online, in terms where maybe the bandwidth is challenged, are they still able to access the course? Over to you, Dr. Ferid.
Okay. Thank you very much, Kesa. So to start with the second question, yes, this course is intentionally, purposely hosted on the WHO Academy course website, and by design, the hosting site is intended to be used in a setting where the internet bandwidth is not significantly high. So it has the content is the animations are created in a way to make sure that there is a smooth transition between sessions and not to affect even in settings where the internet access is very limited, it will be able to work. And based on the feedbacks again, so far we have received that has not been an issue even in very internet restricted areas. People were able to access the course. So that is one advantage of having it on the WHO Academy platform. The other one is who is this course for? Basically, when we try to create the content, we have taken into consideration, okay, who are we making this course for? So we had the impression that this will be able to address the need of diverse cadre of healthcare providers for whom provision of comprehensive abortion care is within their domain of work. So as long as they are involved in provision of comprehensive abortion care, be it a midwife, a nurse, an auxiliary nurse, they can take this part. But beyond going forward, we have, as Leopold and Richard were saying, we have also intended to target, policymakers, program managers, educators the course is designed also to in the aim of talking about a wider perspective other than just the healthcare part, how to integrate into policy, program, and education. So this can be taken by a wide range of people who are involved in ensuring that people have access to quality abortion care. Over to you.
Thank you. Thank you, Dr. Ferid, for that detailed answer. And thank you, colleagues who are adding your questions in the Q&A. And I am noting that colleagues are answering as we go. There is a question from Akual. Please pardon me if I'm not pronouncing the name properly. And I'd like to direct this question to you, Richard. It says, thank you for organizing the webinar. There are some countries where abortion is considered illegal. How do we, the healthcare providers, cope with this? And I'll give you a moment to formulate your answer. There's also a question from Bridget, which asks, would advise to integrate also gender equity and human rights aspect in CAG? And Dr. Leopold, if you'd like to take that one. Let me turn this over to Richard.
Thank you very much for the question, and appreciate the question. I do understand that obviously countries have different laws and policies that govern the provision of comprehensive abortion care services. And in fact, in most countries, abortion is available under restricted conditions. And so it is important for us as service providers and practitioners to understand what those restrictions are, and also to understand then how we can ensure that we are still able to provide high quality services under the conditions of the law. So it is important for us to understand what exactly the law says. I find in a lot of cases, countries will say to me, "Oh, but abortion is illegal in my country." But you will often find that there are conditions under which abortion may be allowed. For example, if the health of the mother or the child is at risk. In some countries, it includes, the socioeconomic status of the woman. In other countries, it includes under conditions of rape and incest. So it is important for us to understand what the law says. But as a service provider, the critical thing where the human rights comes in is ensuring that we provide services that are dignified and respectful, and that really, really care for the woman. And I think that's got to be the heart of everything we do, is ensuring that we provide services that are dignified, respectful, that we respect a client's right to privacy, that we understand that women are able to access these services under certain conditions, and also where women come to service providers presenting conditions under which they are either traumatized as a result of, say, for example, rape. If the law provides for that, then we should be able to provide them with information and counseling so that they can exercise their rights according to what the law allows them to do. So I think the fundamental starting point for me is really understanding what exactly the law says and what the procedures are under which women can then access comprehensive abortion care, and not to just assume that it's illegal, because that's what we hear from a lot of people. Oh, it's illegal. Well, yes, but under certain conditions, it is still legal.
Thank you, Richard, for that. And I'll turn it over to you, Leopold. This question, it's a comment, really, if you'd like to speak to that. It says, I would advise to integrate also gender equity and human rights aspects in CAG. And as Dr. Leopold is getting ready, there is a question from Nuhafitsa. Apologies for not pronouncing properly. It asks, do you incorporate national context and law on abortion in your learning course? And I'd like to direct this one to you, Dr. Antonella. Leopold and Antonella.
Okay, thank you. Thank you very much, Keza. No, I think, the comment is well taken. And this is the essence of this course. It's really to make sure that the human rights are embedded in comprehensive abortion care, which means that services are delivered with respect for women's dignity, autonomy, and confidentiality. This is a key aspect to consider. And it's important also to really make sure that, the human rights are well respected, including, of course, for issues regarding availability of CAC, let's say comprehensive abortion care, the accessibility, making sure that the services are accessible, acceptable, and of good quality for everyone without discrimination. And this is linked with what Richard has already said. This is very important because in some circumstances, in many countries, African region, we have a lot of women and girls who should have access to the abortion care services, but they don't have access because maybe they don't know about this provision of the law. Either the healthcare workers don't know, either the services are not available. So all these aspects have to be addressed so that really all those in need have more access to these services. So these are things we need to consider and remove all these barriers to access to healthcare services. So, it's an important aspect to consider. And the course really ensures that care is not only clinically sound, but also respectful for and non-discriminatory, supporting the broader goals of health equity and social justice. So just to confirm that these aspects are well taken care of in this current course. Thank you, and back to you.
Thank you, Dr. Leopold. And Antonella, if we could get back to that question. And Dr. Ferit, there are operational questions in the chat about how long it takes. If you'd like to go ahead and type those answers as well. Antonella, over to you.
Great. Thank you so much, Kessa. So the course itself does not incorporate specific national contexts because the course is based on the guideline, which includes a set of recommendations that are evidence-based, which considers different contexts from various settings. Having said that, WHO and many of our UN partner agencies work with countries to help them operationalize our recommendations. And we are actually in the process of launching an operational guidance that speaks to, for example, the law and policy recommendations. We also have a clinical practice handbook, and all of these tools are meant to be adapted for specific national contexts. And so we work very closely with our regional colleagues who are here today, as well as our country colleagues, as well as partners within countries. So that includes non-governmental organizations or civil society organizations to help capacitate individuals within national contexts to be able to operationalize our recommendations. Thank you.
Many thanks, Antonella. I'm going to turn this over to Richard to answer the question from Bekele. Thank you for initiating these technical courses, mainly for service providers. I was wondering if there's a plan to have a course on CAC advocacy in light of the growing anti-choice movement and the continued stigmatization in many countries for non-technical people. And I'd like to invite Richard to...
Thank you. Thank you very much for that question, Bekele. First of all, let me just say that I think this course is not specifically is not a technical course in the sense that it looks at the clinical management of comprehensive abortion care. This is a course based on human rights. This is a course that makes people understand the fundamental role that human rights has to play in ensuring that people are able to exercise their rights to access quality, comprehensive SRHR and abortion services. So that's at the heart of this course. The WHO guidelines, just to also put this into reference, if you go onto the website of the WHO guidelines, I hope you don't mind me stealing your thunder, Antonella, but if you go onto the WHO guidelines on the WHO website, there's really fantastic resources for policy and decision makers around how to actually use the WHO guidelines to look at redrafting or reforming laws and policies so that they are aligned to the WHO guidelines and also to human rights principles. What I really like about this course is there's a whole annex to the guideline that outlines the human rights frameworks. And the beauty of this course is you don't have to go and read every single document in that annex to be able to understand the human rights framework, because whether you're a policymaker, whether you're a service provider, whether you're a community healthcare worker, this course will equip you with the knowledge to understand how you can bring human rights into your work and into your area of work. So I do think, the real crux of it will be how countries internalize this guideline, how countries use this guideline within their existing context to ensure that we are able to provide services to people that are mindful of and incorporate a human rights-based approach. Antonella, you might want to add on.
No, that's perfect. And in fact, that saves me time. I was going to mention some of those documents, so it's great to have you mentioning them.
Thank you. And there's a thank you there from Sylvia. There is a comment from Lindsay, and it says, not a question so much as feedback and a connection request. NAF is working on strengthening our language recommendation for our members, primarily for patient accessibility. Colleagues, kindly. Dr. Leopold, thank you. I'm going to start again the comment from Lindsay, and thank you, Lindsay, for the comment. It says, not a question so much as feedback and a connection request. NAF is working on strengthening our language recommendations for our members, primarily for patient accessibility, but also to advocate for expansion of access. excluding acceptability of APCs as abortion provider. Given the connotations of surgical abortion, for instance, we have found that it continues the narrative that abortion is unsafe unless it is provided by a physician in a hospital setting. Let me know if you'd like to discuss. And I'd like to throw that back at the panel, Antonella and Ferit. And this next question from Harmony: does this course take into account the support for young women in prison who are pregnant as a result of abuse suffered in jail and who need to have an abortion? How should assistance services for these women in a prison environment be organized? And I am going to ask Richard and Dr. Leopold to take this one. And there's a thank you there from Carolina. Appreciated, Carolina. And Dr. Subabrata, many thanks to the authority for allowing me to attend this webinar. Whether the certificate of completion of this course is valid in all over the world. So Ferit, you can take that one. So let me go back to Richard on the support for young women in prison, and then Antonella, if you'd like to come in on the comment from Lindsay. Richard, over to you.
Thank you, Kesa. I think, first of all, just to say that for me, Harmony, at the heart of human rights is the principle of equality and non-discrimination. And the principle of equality and non-discrimination means that all people everywhere should be able to have access to services, irrespective of whether they are in prison or not. In an ideal world, we should ensure that women who are incarcerated do have access to full range of SRHR services. Remember, SRHR, yes, we're focusing here on comprehensive abortion care, but SRHR includes HIV, it includes access to contraceptives, it includes access to STI treatment. So it is important for us to ensure that we do meet the SRHR needs of women who are incarcerated. And at the same time, making sure that, under the principle of non-discrimination, that we don't discriminate against anyone when it comes to the provision of services. Because at the end of the day, the right to health has to guide everything we do. And, I keep making reference to people. We don't just talk about sexual and reproductive health. We talk about sexual and reproductive health and rights. And that rights component is as important as the service delivery component. So just to say, from my perspective, from a human rights perspective, yes, we have to uphold the principle of equality and non-discrimination towards all women.
And thank you, Richard. Over to you, Antonella.
Great. So on the question around, by Lindsay, around the connotations of surgical abortion, for instance, and the ways in which certain narratives are being perpetuated. So one of the things that I want to highlight in terms of the guideline is that we were very clear to note that there is no single recommended approach to providing abortion care services. And in terms of the choice of specific health workers, for example, from among the recommended options, of which the individual abortion seeker themselves is one, or management at different locations, including in outpatient or community-based settings. All of these things depend on a variety of factors, including the values and preferences of the individual abortion seeker themselves, as well as considering, obviously, what can be done within the national and local context. And so we're working with our regional and country colleagues to disseminate the fact that there is a plurality of service delivery approaches that can coexist within any given context. And so when the range of service delivery options are taken together, we know that that means that individuals will have access to scientifically accurate, understandable information at all stages, that they have access to quality assured medicines, including for pain management, for example, backup referral or support if they need them. And then linkages to an appropriate choice of service, for example, family planning if they desire it afterwards, or other services, as Richard mentioned, for those who need it related to the abortion care. And so we're doing our part in terms of thinking about how we can challenge that narrative. And then we rely, obviously, on our partners within the community to help us in that work. And so maybe I'll turn it over to Fareed to answer some of the other technical questions.
Yes, so two more questions on the technical aspect. The whole course duration is about expected to finish about 3 hours. But most important thing, as I said earlier, learners does not have to go through the whole course at once. We understand people are busy. Maybe you are doing your clinical work or you're doing your office work. So you say, let's say you have like half an hour just to go through some of the exercises there, interactive exercises for half an hour. You can stop wherever you want and again resume from where you stopped. So it doesn't have to be like a one go 3 hours. So it can be like half an hour once and just like that. With the award of completion, once you complete the whole series of exercises in the module summary, immediately you will be awarded with award of completion. At the moment, we are actually the WHO Academy is trying to work with national organizations on how to ensure that this can be actually counted as a CPD, a continuous learning program, a CME, for continuous medical education for those countries who have such requirement as part of professional license requirement. So I hope it will be in further efforts will be made with the WHO Academy to make sure that such courses will count to such professional licensing requirements so that it will be an additional input for the learners. Over to you.
Thank you, Farid, and that is clear.
Tessa, maybe I can
Dr.
come in just for.
Yes, please go ahead.
I just want to add one thing to Fareed's comment about, in particular, about when you take the course and the length of the course. It's important to note that this course, and actually several of our courses, have relevant resources that have been incorporated and linked throughout the course. And so it really also depends on the individual learner, how much they want to delve into the aspects of the course and the context. And so, I know Fareed mentioned that the course could take, after completing all the modules, approximately 3 hours, but it is possible that it could take longer if you're really interested in exploring many of the additional resources that exist. And we do that because we want to ensure that individuals can adapt really their evidence-based approaches to their own professional settings. And so we've even included case studies to illustrate how these principles have been successfully applied in different contexts, because we want these resources to be practical references for participants beyond just the course, to really guide their program work, their advocacy, and their service delivery. Thank you.
Thank you, Antonella, for addressing that. And I'd like to recognize to welcome to the panel Dr. Adini Adaroba from WHO AFRO as well. And Dr. Adini, do feel free. I'm going to direct the next question to Richard, which is from Makul, who says, thanks for answering my first question. Actually, it's my first time to join such a webinar, so I'm going to ask more. I want to understand if abortion is the same as family planning, because family planning can be the choice of a couple or an individual. A married woman may come to seek safe abortion care without the consent of her partner, and this may bring family community issues, may even lead to divorce. Richard, if you'd like to come in, please.
Thank you very much, Akul, for those questions. So first of all, let me just say, no, abortion is not the same as family planning. So in general, the first preference has to be to ensure that all women have access to family planning so that they can prevent an unintended pregnancy. Family planning in this context not only refers to contraception, but I also include the emergency contraception in the event that is required. For many women, the decision to terminate a pregnancy is a very difficult and a very painful and a very personal decision. And it is important for us to keep in mind that for those women going through that decision, for whatever reason they choose to make that decision, we need to also be able to respect those decisions of that woman. Which brings me to the second part of your question. And I'm actually not going to answer your question. I'm going to ask you questions back for you to reflect on. So the question that I always ask back to people is, who should decide? Is it the woman's right to decide over what her body and her bodily integrity? Is it the man's choice to decide? Who decides? And I don't think there's an easy answer to that question, because the issue is, like I said, this is a very, very deep and personal decision that women who choose to have abortions will go through. And we also need to keep in mind that, while we're talking here about induced abortions, there's also a lot of women that may have abortions owing to stillbirths, and many other reasons. So, it is important for us to when we answer this question, to really ask who should decide. And I'm going to leave it at that. I'm not going to even try and answer that decision, because, like I said, I think who should decide is a very deeply personal, individual response that someone will give based on their circumstances.
Thank you, Richard. And we have, I think, answered most of the questions. If there are a few more questions come through, we can give it the next 5 minutes. I do have a question that I'd like to pose to you, Dr. Adeni. And this question is, what is the need for this course? And why do we need to integrate human rights-based principles into programming, into comprehensive abortion care? Dr. Adeni?
Thank you very much. I hope you can hear me.
Yes, we
Hello.
can. Thank you. Thank you.
Good
And if you
afternoon.
have video, it'd be great to see your face. Thank you. Over.
Yes, please. Thank you very much. I hope you can hear and see me. I think going to the question, why this course? And I'm sure colleagues that made presentations earlier must have said a bit of this. This course is very important because in the first case, the burden of disease that we're trying to tackle in terms of sexual and reproductive health and rights, it's very high in the African region. We all know that we have a disproportionate amount of maternal deaths in the African region, of which a number of them are due to unsafe abortion. And if we have to look at that, we also have challenges in terms of barriers that exist for us to be able to access sexual and reproductive health services, including comprehensive abortion care services. So this course is important because some of these barriers are due to cultural issues, due to religious issues. They are also due to more underlying issues around policies, around laws that restrict access to these important services. So if we look at some of these barriers, looking at it from the human rights perspective gives us another approach to program that ensures that everybody is able to access these services. It then becomes an equity issue, it becomes a right issue, and that's why this course is important, because it gives us the opportunities for the different set of stakeholders around programmers, around clinicians, around policymakers to have the tools, the competencies to be able to program and ensure that the basis of providing services is equitable and from a human rights perspective. Over.
Thank you very much, Dr. Adeni. We couldn't see you, but we heard you loud and clear, and thank you for that comprehensive response. Dr. Leopold, I'm going to turn this over to you and to just ask this question here. What would success look like for after completing this course? If we could share that with the participants and those who are interested in taking this course, what changes would we hope to see in practice or in the health systems? Over to you, Dr. Leopold.
Okay, thank you very much. I think I will start by maybe following up with a previous question that was related to a practical case of a woman getting pregnant in a prison as a result of sexual abuse or rape. I think this was one of the practical case put forth for one of attendees of one of participants, and I think this is really something that we need to really address, and showed us that this cause is very important, not only for the healthcare workers, service providers, but also very important for policymakers and program managers. This is very important because, as we say, all the program managers, policymakers should make sure that these services are available, accessible, and offered with high quality, including confidentiality in all settings, and that everyone in need should have access to that. And as Richard and other colleagues also mentioned, in fact, when we look at in our continent, in our region, African region, in almost all the countries, abortion is allowed in such situation of rape, incest, and others. It's allowed. We should say abortion is allowed except certain circumstances. We need to change also the language or wording, because we are creating some useless barriers due to the way we are putting things forth. So in that cases, I'm saying its abortion should be offered, except maybe in a fewer number of countries such as Madagascar, Congo, where there is no clear provision of ground law regarding this kind of situation. If not almost the countries, it should be offered. But the problem, as I said, is the woman herself aware of that? Are healthcare providers aware of that? Are the program managers, policymakers aware of that? And what is available? Are the services ready to offer the support, the information, and the required services? So these are important aspects for us to consider moving forward. And to this end, I think and I believe that a key success after this course should be for all the healthcare workers who attend this course, program managers, policymakers, to be well equipped, to really be able to offer, to put in place this kind of information and services, and this kind of services for such women in need. And this finally will allow all the women and girls in need to have access to high quality services with respect to human rights. And I think that this ultimately will lead us to reduction of maternal mortality due to unsafe abortion in our region. Thank you, and back to you.
Thank you, Dr. Leopold. And Antonella, I've seen that you have answered the question from Akul, and thank you very much for that. I'm going to take 2 additional questions and then turn it over back to you, Antonella, to continue with the webinar. Dr. Subrabrata, thank you for this comment, which says comprehensive abortion care courses are a very good course for global community perspective. After open, WHO courses are very good. Hope it will be accessible to all students. Slow internet connections also make it difficult to access through academic courses. Please make PDFs available for this course. Abortion safe is also important for threatened abortion or spontaneous abortion or missed abortion. And thank you for that. The colleagues are taking note, and I don't know if Dr. Farid, you just want to come back on the internet thing, and also in terms of access to students. And Antonella, you may buttress as well. Over to you for that comment and recommendation from Dr. Subrabta. Subrata. Thank you.
Yeah. So yes, as I said earlier, the course we intentionally hosted it on the WHO Academy because of its wider reach and the demand for high bandwidth internet is not that much significant with the WHO Academy. And the other one is stay tuned for the mentioned courses on like threatened abortion and spontaneous abortion as part of the post-abortion care course. We are working on another dedicated course that will be launched very soon, and it will be covered in those upcoming courses. Over to you, Antonella.
We don't have anything additional to add there. I was just typing an answer to a question, but maybe I'll just say it in live. So there's been a couple of questions about the human rights-based approach and whether or not there are other types of approaches that exist. And there are many approaches that exist. I mean, today, obviously, we're speaking about the human rights-based approach because that's what the course is built off of. But there's there's health system strengthening approach, youth-centered, gender equity, public health, many approaches. So but the point is that they don't actually have to be considered separately. And many of these, these approaches work together and they're interrelated. And so it's important that we consider an intersectional approach in all of our work. And while we're highlighting this one specific approach today, that's quite critical and core, there are many different ways to work on this at the same time in parallel. Over to you, Kessa, or would you like me to take it back over?
Thank you, Antonella. I would like to invite you to take it back over. And for additional questions, colleagues, kindly feel free to engage over email, and we can take it further. We will close the Q&A here and proceed to the next agenda item. Over to you, Antonella.
Great, thank you so much. So actually, this brings us to the end of our webinar. We want to thank everyone for joining us today and really for your thoughtful engagement, your very interesting questions, and we're excited to see that you're so interested in this work. In launching this course, we really hope that it will support you in strengthening the competencies needed to deliver comprehensive abortion care that's not only clinically sound, but grounded in human rights, equity, and respect. And we hope that you'll share this course as well as the others with your colleagues who may benefit from such training. But we want to hear from you as well because your experience matters. So after completing any of the courses, you'll have the opportunity to share feedback directly on the Academy online platform. And there are optional surveys that are offered. And we want to use that information to continue iterating this course as well as the other and to continue to improve in the way in which we deliver this information to you. So as we wrap up here, we're showing the QR code once more so that you can easily access the registration page and begin exploring the course offerings. And thank you once again for being part of this very important conversation. And we look forward to learning with you and from you. Thank you. Have a great day, everyone.
Okay.
Thank you.
Thank
Thank you.
you.
Bye-bye.
Have a good
Bye.
day. Bye-bye.
Bye.
Bye.
Yes.
Thank you. Bye.
Thank you.